I'm Jennifer Martin and welcome. Let's dive into the subject of multiple sclerosis, or MS as it's commonly called, and hopefully help you to gain a better general understanding of this disease. So what is multiple sclerosis? The cause. Multiple sclerosis, or MS, is thought to be an immune disease. This means that your immune system will mistakenly attack the myelin coating around the nerves, interrupting communication between your brain and the rest of the body. So myelin is a mixture of protein and fatty acids that coat nerve fibers. And when that coating is damaged, nerve cell bodies can be damaged, creating a disconnect in the neuron communication. What are some risk factors? Risk factors include a family history of MS, and while having a parent or sibling with MS increases the likelihood of a person getting MS, it is not thought to be an inherited disorder. Epstein-Barr virus infection history and vitamin D deficiency have also been linked. Vitamin D may help regulate the immune system in ways that reduce the risk of MS and autoimmune disorders in general. So what's interesting is that because a high level of vitamin D is linked to people from regions near the equator, there is a great deal of sunlight in those areas. Generally, those folks have a lower risk of MS infections. So how is MS diagnosed? MS can be diagnosed with MRI scans that show the areas of damage in the brain and spinal cord, or evoked potential tests that measure how quickly nerve signals travel through your body. Who's affected? So there are nearly 1 million people in the United States that have MS. Most of them are women, and they are mostly of Northern European descent or white. MS symptoms will usually begin in young adults between the ages of 20 and 40. Treatment is incredibly important. Without treatment, you may be led to decreased mobility and, of course, a decreased quality of life. The life expectancy for someone with MS may be reduced by up to 7 years. However, that continues to improve, and in most patients, life expectancy can be unaffected. While there's no cure for MS yet, lifestyle choices such as pharmaceutical options are imperative, really, in maintaining optimal health while living with this disease. Let's talk about some of those treatment options. So as I mentioned, lifestyle, staying active with exercises, stretching, the use of walking assisted devices when necessary, incredibly important. Now, when it comes to prescription medications, everyone's experience with MS is unique. There are 4 different classifications of MS, and they're categorized according to the symptoms. So treatment options will vary depending on the severity and the type of those symptoms. Corticosteroids quickly and potently reduce inflammation, while disease-modifying medications are designed to modulate or suppress the inflammatory reactions from the disease. So both work to suppress the immune system to treat and help prevent flare-ups. And then there's also the use of complementary medicine, implementing stress management techniques, relaxation practices. Some practices like acupuncture, meditation, or yoga have also been found to be very helpful in instances. So support is incredibly important. These are some links that I myself found during my research I think might be helpful for anybody that's been recently diagnosed or previously diagnosed with MS. I found that the National Multiple Sclerosis Society is a wonderful site for finding support groups and addressing real life questions such as how to disclose your diagnosis or how to communicate your symptoms or diagnosis to your loved ones, which can sometimes be complicated. So I just want to thank you all and remind you that MS is a journey that doesn't have to be traveled alone. With the right support system, access to resources, and a proactive self-care approach, a full and meaningful life with MS is very much achievable. Remember, there is always hope and there is always help. I thank you all again for attending today's session and wish you all the very best.